Okay, so let's discuss implementation. Okay, so when you say implementation, okay, it's a process of carrying out the planned teaching learning activities. So, minimeasure niya yung achievement ng objective mo, effectiveness of the strategies, progress towards the program goal, and requires continuous adjustment based on the patient response. So what are the principles of your implementation? Teaching may not go exactly as planned. So we need to keep that in mind. So kayo as student nurses at pag naging future nurse, you must constantly assess patient's response. Okay? I-assess mo, interested pa ba siya? Nag-work ba to? If not, you need to adjust the teaching accordingly. Okay? Whether the strategy, the resources, so you need to adjust it. Use simple and clear language, okay, when doing your implementation. Okay? Hindi pwede na hindi ka naririnig. Okay? Hindi pwede na nagbibigay ka ng instruction in English, hindi pala nakakaintindi ng malalalim na English yung patient mo. Okay? So you need to use simple, clear language and be specific and concise po. Now, interpersonal skill in the implementation. So this is the effective teaching depends on rapport and trust. Gaya ng una natin sinasabi, we need to establish a rapport. So nurse should show empathy, be sensitive to patient's need, and encourage question, okay, during the implementation stage, and use non-judgmental communication, which you learn dun sa therapeutic communication ninyo ng fundamentals of nursing. Ano ba yung mga therapeutic communication? Okay, ano ba yung dapat hindi natin ginagawa? Okay, yung mga close-ended, right? Now, what are the steps in implementation of teaching plan? First, what, when, where, who, how. What will be taught? Okay, ano ba yung kailangan versus a need to know? Okay, when teaching occurs, okay? Kailan mo ba ituturo to? Morning, evening? Okay? Kamusta ba ang attention span nitong patient na to during that time? Okay? Where teaching takes place, okay? Is it a forum? Private ba? One-on-one? Okay? Meron bang provision para sa isang health teaching or tahimik na room para mag-discuss kayo? Okay? Who teaches and who learns? So this include what? Caregivers if needed. And how teaching is done. So anong learning style and method ang gagamitin mo? Alright? Next, timing of the teaching. So, consider patient's preference. Assess learning fatigue, okay? Tignan mo, baka during the session, okay, humihikab na, nagkakalos na ng attention span. Please take note that the ideal session is less than or equal to 30 minutes or shorter session if needed, okay, during the time of teaching po. Okay? Teaching environment. So, ensure again, comfort and privacy. Reduce yung mga distraction. Okay? Mahirap mag-discuss kung merong in pain o kaya nasa bedside ka, yung katabing kama is for wound care, okay? Tapos first time or debridement na tinatawag, okay? So masyadong magiging in pain si patient, he might make noise, okay? So you need to check your environment. Include caregiver when appropriate, okay? Especially if, let's say, favorite nating example is insulin, okay? Tapos si patient old age. So dapat nandun si caregiver, kung sino makakasama ni patient, okay? Para mapasahan mo din ng information. At the same time, siya pwede niya ipasa yung information. And use peer support if helpful po, okay? Teaching method based on the learning style. So yung sinabi natin, visual ka ba, auditory, tactile, so depende ano ba yung teaching method or style na kailangan mo. Okay? Now, implementation of health education plan is the working or the action phase of health education process. So just like your nursing process, it involves applying the health education plan based on the patient's need, yung elements natin, readiness, learning style, and yung level of understanding po. Okay? Now, this is the stage where ikaw as a nurse carries out the teaching strategies and activities planned during your planning phase po. Okay? So, during implementation, continuously assess the patient's response. Okay? Katulad nga yung kanina, yung learning fatigue. So, you adjust teaching method when necessary. And effective implementation requires the nurse to what? Use a language that patient can understand, just like what I've mentioned earlier. Present information clearly and specifically. Keep explanation short, simple, and organized. And focus on the important information first. In health education practice, implementation also involve evaluating whether objectives are being achieved, planned activities are effective, and strategies are helping accomplish the program goals. Alright? Now, what are the activities that help create environment conducive for learning? So, unang-una is what? Showing genuine interest in the patient. Okay? So, this one, okay, ikaw as a nurse should demonstrate sincere concern and attention towards the patient's needs, okay? So, when patients feel na hindi naman sila bina-value and cared for, naging uncomfortable sila, so pwedeng hindi sila mag-participate sa learning, okay? So, example mo, ikaw as a nurse, you ask the patient how they are feeling before starting the health teaching, and you listen attentively to their concern. Okay, so that is showing genuinity. Okay, including the patient in every step of the teaching and learning process. So dapat actively nagpa-participate sila. Okay, in planning, decision making, learning activities, rather than just simply receiving the instruction. So active involvement, okay, is need to be fostered. So let's say ikaw as a nurse, you ask the patient which topic they would like to discuss first regarding diabetes management. Okay, so pwede ka mag-impose. So gusto ba natin na malaman muna ano ang diabetes o diretso pa tayo sa insulin injection. Okay, use non-judgmental approach. So you should as a nurse avoid criticizing, blaming, or making the patient feel embarrassed about their health behavior or condition. So, respectful attitude, encourage openness and trust. Okay? So, hindi mo pwedeng pagalitan, smoke ka kasi ng smoke, ayan, nagkaroon ka ng pneumonia or ng PTB. So, again, we need to be non-judgmental, okay, yung approach natin. And communicating at the patient's level of understanding, okay, just like what I've mentioned. So, let's say, hindi naman sila familiar, ano ba yung hypertension, okay? So, you just simply explain high blood pressure po. Okay, mataas po yung BP natin kapag mayroon tayong hypertension. So, yung maiintindihan ng patients. Now, what are factors hindering implementation? Lack of resources, okay? Limited yung budget or financial support, okay? In terms of teaching material, wala kayong ma-print equipment. So usually this is for community, community setup, okay? Let's say may health teaching sa barangay, okay? Wala palang pondo. Okay, lack of human resources, walang nurse para magbigay ng health teaching, walang educator. So it affects the health teaching po. Poor attendance, okay? Participants may fail to attend the teaching session regularly. Okay? So that would affect the learning session kasi may work responsibility sila. Low participation, same po, and inadequate training. So hindi natin masyadong natitrain, okay, yung mga trainers natin. Okay, so those are factors influencing implementation. So technically for the implementation, yung discuss natin ng mga teaching methods, okay, that would be the thing that you would be implementing at this stage. So this is just a short discussion. Now let's go to evaluation. So when you say evaluation, it is defined as a systematic process that judges the worth or value of something. Sa example natin or sa scenario natin, this would be what teaching and learning. So ano ba yung difference, okay, ng assessment sa evaluation. Okay? Kasi nagkakaroon ng interchange sa kanila. So sa assessment, yung process is gathering, organizing, and interpreting. Okay? And sa evaluation, okay, gathering, summarizing, and interpreting as well. Okay? Yung mga data natin. Okay? Ang pinagkaiba nila in terms of yung pangalawa, organizing sa assessment, summarizing sa evaluation. Kasi nga ine-evaluate mo na, chine-check mo na, gina-judge mo na yung work ng trinabaho mo. Okay? Assessment done before or at the beginning of the teaching. Pag-evaluation done during or after the educational activity. So ano ang purpose ng assessment? Identify the needs, yung readiness, and guide planning and decision making. Sa evaluation, ang purpose mo, you determine if teaching was successful. Minimeasure mo yung achievement ng objective na sinet mo ng planning, and you assess the learning outcome po. Okay, so that is the main difference of the two. Now, determining the focus of the evaluation. So, ano ba yung focus mo? Sino-sino ang focus mo sa evaluation? That would be the audience, the purpose, question, scope, and resources. So, let's discuss them one by one. So, first, audience. So, refers to the individual or group for whom the evaluation is conducted. So, meaning, sino ba ang iyong i-evaluate? So, si patient, yung group ng let's say group ng antenatal, okay, so those are your audience. Purpose, you need to this is explain why the evaluation is conducted. Okay, so purpose may include what? Determining effectiveness of the teaching, deciding whether to continue a program, and measuring the learner performance. Okay, so again, ang purpose should be clear, specific, singular, focus po. Okay, next is question. Okay, when you determine the focus of the evaluation sa question, yung specific and measurable question asked during the evaluation. So ang characteristic niyan related directly sa purpose po. Clear and measurable dapat yung question. Example, did the patient learn proper wound care? Okay. Are patients satisfied with the health teaching program? Okay, so that is an example po. Then, yung scope po refers to the extent or coverage of the evaluation. It includes what? Number ng learners evaluated, duration, areas, or activities na included. Example, one teaching session lang yung scope nitong health teaching session na to, or entire health education program. One patient lang to. One patient versus all patient pa siya sa unit. Okay, so that is scope. And the last would be your resources. Okay, this refers to the available materials and support needed to conduct evaluation. So includes time, personnel, expertise, equipment, facilities, and budget materials. Okay, now ano yung tatanungin mo for you to determine the focus of the evaluation? So for audience, di ba limay na discuss natin? Ang tatanong mo, for which audience is the evaluation being conducted? Sa purpose, what will you ask? For what purpose is the evaluation considered? For question, which question will be asked in the evaluation? Sa scope, what is the scope of the evaluation? And for resources, which resources are available to conduct the evaluation? Okay, so this is the questions that you need to ask in order for you to determine the focus of the evaluation for the 5 factors that we discussed. Now let's go to evaluation models. So when you say evaluation models, this is a framework used to classify and organize evaluation method. Purpose, you select the appropriate evaluation method, organize the data collection, and analyze the educational effectiveness po. So we have different models po. So first is the process or the formative evaluation. So when you say po process or formative evaluation, this is an ongoing evaluation done during the teaching process. Operative word would be ongoing evaluation. It helps identify problems early and make immediate changes. So during formative evaluation, ginagawa mo siya ongoing pa ng yung teaching session. Kasi gusto mong makita, may problem ba para ma-address mo na. Okay? You make immediate changes. You focus on improving the teaching learning experience while it is happening. So, bakit siya importante? It allows the nurse educator to adjust yung method, material ba ang problema, environment, objective, communication style. So, main question you need to ask is how can teaching be improved to help learning? Okay? If you identified po na merong problem, okay, during your formative evaluation. So, nurse continuously observe learners' participation, yung tinatawag na